Hey, good morning. I'm Vic Senese with UroNurse News. Be sure to like and subscribe. Today we're discussing an important new study that could change how we think about preventing recurrent urinary tract infection in women. Researchers have found that women who received a prescription for vaginal estrogen had significantly lower risk of sepsis, hospitalization, and even death following recurrent urinary tract infections. So let's look at what the research found and what this could mean for patients and healthcare providers. Recurrent urinary tract infection is incredibly common, especially among postmenopausal women. Many women experience repeated infections because declining estrogen levels can change the vaginal environment, reducing healthy bacteria, thinning protective tissues, and allowing harmful bacteria to grow more easily. These changes are part of what we now call the genitourinary syndrome of menopause, or GSM. Current clinical guidelines already recommend vaginal estrogen for many perimenopausal and postmenopausal women with recurrent urinary tract infections. But until now, there has been limited information showing whether this treatment actually reduces serious complications beyond improving symptoms. Now that's exactly what this study wanted to answer. Researchers analyzed data from the Epic Cosmos Electronic Health Record Database, one of the largest healthcare databases available. The study included nearly 1.9 women between the ages of 20 and 99 who had recurrent urinary tract infections. Researchers compared women who received a prescription for vaginal estrogen within 2 months after their second documented UTI with women who did not receive vaginal estrogen. Now, for up to 8 years, looking at 3 major outcomes: sepsis, hospitalization, and all-cause mortality. The results were impressive. Across every age group studied, women prescribed vaginal estrogen had significantly fewer complications compared with women who did not receive vaginal estrogen. They experienced lower rates of sepsis, lower rates of hospitalization, and lower all-cause mortality. The reductions were consistent, whether women were in their 20s, their 40s, or their 60s, or well into their 90s. One thing stood out even more. Only about 5% of women with recurrent urinary tract infections received a vaginal estrogen prescription shortly after diagnosis. Researchers believe this suggests the therapy remains significantly underutilized, despite current guidelines and recommendations. Now, while this was an observational study, it cannot prove that vaginal estrogen alone caused better outcomes. The findings add to a growing body of evidence supporting its use. Researchers suggest that better education for both clinicians and patients may help overcome misconceptions regarding vaginal estrogen safety and effectiveness. They also recommended incorporating vaginal estrogen more consistently into preventative care for the appropriate women with recurrent urinary tract infections. As always, treatment decisions should be individualized and discussed with the patient's healthcare provider. This study reminds us that preventing urinary tract infections isn't just about reducing discomfort. It may also reduce the risk of some very serious medical complications. Sepsis is nothing to monkey around with. As additional research becomes available, we'll continue to bring you the latest evidence that impacts urology practice and patient care. I'm Vic Senese. Thanks for joining us, and have a wonderful, healthy day. Hey, tonight, tune in for Dr. Jeff talks about sex and intimacy. What if the key to a more satisfying sex life isn't trying harder, but playing more? Join Dr. Jeff for a special follow-up panel discussion to our popular episode, The Power of Play. He's joined once again by Lena Elkatab, an internationally recognized sexuality educator and clinician, and fan favorites, Dr. Susan Kellogg-Spate, for an engaging conversation about how bringing playfulness back into your relationship can strengthen emotional connection, increase desire, and create more fulfilling intimacy. So, you see where it's at right there, drjeffsextalk.com. Tune in 7 p.m. tonight. Now, join us tomorrow on UroNurse News. A prostate cancer diagnosis doesn't always begin with a rising PSA, symptoms, or an abnormal screening test. Sometimes cancer is discovered unexpectedly, found during a procedure done for another reason, like going in for a prostate trimming. But what does an incidental prostate cancer diagnosis mean for a patient's future? Want to find out? Tune in tomorrow.
The experts' opinions in this communication are personal and not representative of any organization. They are for informational purposes only, not official guidance. Viewers are advised to use their judgment, seek additional advice, and take responsibility for any actions based on these opinions.